Hi, and welcome to part 1 in our series of demonstrations where we show the block nurse how to prepare, assist during, and recover a patient for a catheter insertion procedure for the use of an on-key pump. Part 1 reviews how the nurse sets up the space for the patient prior to the patient's arrival. One of the first steps that the nurse will do is set up the ultrasound machine. Our providers use this as the procedure is done under ultrasound guidance. Though I'm not going to have real patient information in here, I'll show you how we set this up. So it's important to understand an epic order drives a patient having the ability to appear in this machine. So at any point during the process, if we need to troubleshoot, we'll look for that epic order for an order titled US Guidance by Anesthesia. So we know that we have a patient coming to the PACU or on the ICU for the block procedure. We need to find the patient in the ultrasound machine. The steps for that are to turn the machine on. The button is on the back of the machine. Select patient and information. You'll then wait for the screen to load. Sometimes it takes a while. And you will type in the first three letters of the patient's last name in this field. It's a touch screen, so you simply touch it. And you would type, John Doe, so D-O-E, and OK. That then brings up a screen where we can query for all patients with that last name for the ultrasound order. When you find the patient, you hit query, and we will search for any of those orders. On the next screen, if the patient has the order in Epic, you will be able to select the patient's name, click a button, select, and done, and that will load the patient in the machine for the provider to use during the procedure. If at any point you cannot find the patient and the order in the machine, you can troubleshoot it again through Epic by placing an order for US Guidance by Anesthesia. And there's a nurse protocol for this, so you don't need a verbal or telephone order from the provider to do so. If at any point in time you have issues finding this order, placing it, get a duplicate, you can simply troubleshoot that with someone else on the unit, or if you need to, call the provider performing the procedure and they should be able to assist. Once you have the patient selected in the machine, you will come back to the main screen of the ultrasound, and you will be on the screen where the patient's information will display on the top, and the ultrasound will be ready for use in the procedure. The last step for the nurse is to prepare the probe. You will be using most times the linear probe, which is the straight edge, and you will simply apply a tegaderm over the probe itself. A couple of our providers like a thin layer of ultrasound gel underneath that tegaderm, and that's indicated on our sterile gloves sheet located in the PACU and in the inpatient holding area. Once the tegaderm is applied, it's snugly, I can actually show you guys, my assistant's here. You place the tegaderm on the probe. You simply adhere it from either side, pull as snug as possible. Again, some like gel underneath that application. You peel away the border and adhere it as best as you can. You can then set the probe back on the machine, and it's ready for the procedure and the patient to arrive. The other supplies that will be gathered by the nurse are those that we'll put on our procedure table. These include the catheter kit that's specific for the infusion, the sterile gloves that the provider will be using for the procedure, the catheter needle, and the catheter kit, several different ways to gather the material. You can either have the catheters here, there's actually a replacement kit, there's a couple different ways to do it. Basically, you'll have the catheter kit and the needle itself ready for the provider. We also will get for the provider a ChloraPrep stick to sterilely prep the patient, extra tegaderm, both for the ultrasound machine if needed, and the patient later on, some sterile gel for the ultrasound machine, and a little bit of gauze to clean up after it's all done. This is all you need to have ready before the provider arrives, and then we're ready for our patient to get here. Thank you, and make sure you watch parts 2 and 3 of our catheter demo.